troubleshooting, but I have Dr. Caudle here, Dr. Jan, and I want to welcome you. First of all, let me thank you for being one of the frontline service individuals. How are you doing and how are things on the front line?
I'm doing, I think, as well as can be expected for anyone. Just a little bit about my background so people know is I'm a family physician, and I've been in practice for about 12 years or so. I am not necessarily on the front lines like those who are working in the ER, those who are critical care and hospital workers. I am seeing patients, and I do see patients. In fact, I start seeing patients in a couple hours today, but we're doing everything by telemedicine, by telehealth. So, kind of like even the way we're communicating. So I'm still treating patients. I'm still sort of assessing patients for symptoms of COVID-19 and also treating the regular conditions. But yeah, this is a turbulent time for all of us. I really have to say it's not just people who are living in the communities, but it's healthcare workers as well. It's this is unheard of. We've never seen anything like this.
Yeah, yeah. The news media is actually calling the virus the great equalizer, meaning anyone can get it. Can you advise us on how we can actually stay safe?
Yeah. Coronavirus is something that I've been talking about in the news for a number of weeks now. As you know, I do a lot of television. So I go on Dr. Oz, HLN, Rachel Ray, Steve Harvey when he had a show, and CNN, you name it. And I probably have done maybe 40 to 50 TV appearances on coronavirus really since it started bubbling up in our country, even in January. So it's been interesting to see how this has all evolved. The biggest thing that we're seeing and what we know right now is that social distancing is our one of our best weapons against coronavirus. This is a virus that can spread relatively easily, and we think that a number of people in the community are having what we call asymptomatic spread. So
Hmm.
if you've heard that term, I know people might wonder what that means. That means that they don't feel sick, they don't think they're sick, but they do actually have the virus in their system. They are infected by the virus, and thus they can still transmit it to other people, even though they don't realize they're sick. So they're walking around doing their thing or going to the grocery store or whatever. That brings me back to this social distancing. That's what everyone is talking about
Hmm.
on the news. It's what I've been
Hmm.
talking about. When I say we need to social distance, I mean it. That's staying 6 feet away from other people, really not leaving the house unless you absolutely have to, going to the grocery store, to the pharmacy. This means not just stopping over at your mother's house to visit. This means not going over to your aunt and uncle's house or your cousin's house just to spend time. None of that can happen at this time. And the reason why is because we don't always know who's infected, and that's how it can spread. So, the way that we back down on the spread and we cut the spread, stop the spread, is we keep people separated as much as possible so they can't give it to each other. Of course, we also have to wash our hands 20 seconds or longer with soap and water. Wash them a lot. If you're not sure if you're washing enough, I'd rather have you wash them too much than not enough. Using hand sanitizer when we can't wash our hands, coughing or sneezing into our elbow, not touching our face, which is how the virus can get into our body. Those are things we need to be doing.
Yeah, so many people are running scared. There's a lot of fear.
Yeah.
I get so many emails, so many texts from a lot of people around the world.
Yeah.
There's a lot of conspiracy theories that are going on,
Yes. Yes.
especially with 5G, which is crazy.
It is.
But I want to talk about how can people boost their immune system.
Sure, sure. And I hope at some point we can talk a little bit about those myths that you mentioned, including the
You know
5G,
I'm
because
gonna go there. You
okay,
know I'm
good.
gonna go
Okay.
there.
Excellent. I wanted to make sure we at least had that in our conversation because that's super important. But yeah, boosting our immune system. I'm doing daily coronavirus videos on my Facebook page and on Instagram, and I do a different topic every day. And this was actually a topic that I did a couple weeks ago was ways to boost your immune system because we all want to know how can we stay as healthy as possible to at least just make sure we are as strong as we possibly can be if we were to ever come in contact with the virus. Now, these things are not going to necessarily cure coronavirus. They may not even prevent you from getting coronavirus, but these are good general things that we can do to keep ourselves healthy. I would say the first thing is to not smoke. Remember, coronavirus often causes respiratory symptoms, shortness of breath, and pneumonia, and things like that. If you smoke, this is the time to quit. If you ever needed a reason to quit, that this would be
Mhm.
a really good reason. And for those of us who don't smoke, please don't let the stress of coronavirus start you smoking. This don't start smoking, okay? I would also say, general things that I love to recommend to my patients for keeping our body healthy is we know that stress takes a toll on our bodies. We know it just does. Now, this is not an ideal time. We are all stressed, but finding ways to minimize your stress even during this time is going to help us tremendously, whether that's meditation or, just sort of taking 5 minutes out the day just to stare out the window and, kind of think about nothing. There are a lot of great apps out there. And I actually have a video on my Facebook page about different apps that can help you relax and meditate and deal with any anxiety or depression you have. But relieving stress, making sure we're getting enough sleep, making sure that we're eating healthy. We are at home these days. That's not
Yes.
licensed to sit on the couch all day eating bonbons and Doritos. Okay. So, and I got to remind myself of that too. I'm saying that not just for everyone out there, but myself. I have to say, Jennifer, this is not a snow day. This is not a free pass.
Yeah,
So,
yeah.
and then exercise. We can't be around other people, and even being outside. Many places, many states have mandatory stay-at-home orders. That means you shouldn't be going outside just to go outside. So find ways inside your house to get some activity, whether it's weights, whether it's push-ups, whether it's sit-ups, yoga. There's a lot of apps that have free exercise regimens that you can do inside your house using some steps. Those are things I recommend.
That's so good. So good. Now, I want you to please explain how exactly people that are feeling sick, what should they do?
Yeah. So if you're feeling sick, I always say the first and most important thing to do is to call your doctor, because what we can do and what we should be doing is helping you sort through your symptoms and figuring out what's going on. This is allergy season, for example, for a lot of people. And I say that to say that cough, for example, is a symptom of coronavirus, can be. But it's also a symptom of allergies. I noticed this was a couple weeks ago. I got a dry cough. I was walking around. I said, oh, oh. Oh my goodness. I kind of got myself freaked. I mean, I'm a doctor, right? And I got myself freaked out. And then
Exactly.
I had to stop and take a moment and think. And I was like, oh wait, my eyes are itchy, my eyes are watery, my nose is running. Oh, this is my allergies, right? So the
Yeah,
first
yeah,
thing is
yeah.
calling your doctor so we can go through what your symptoms are, help you figure out what they might be, and then determine whether you need testing for coronavirus if that's what we think it is, and further guidance.
Great, great. So let's talk about coronavirus and post coronavirus, if there's
Yeah.
such a thing.
Okay.
So, what do you predict the next several months is going to look like?
That's a really good question. If I'm being honest, I'll tell you I can't predict it, and I have no idea.
Hmm.
I'll tell you what I hope. I hope, and many people have probably heard about the phrases flattening the curve and the
Hmm.
apex of the curve. When we
Hmm.
talk about the curve, okay, just so people know, scientists have been working to basically try to do what you're asking me, which is they've been trying to kind of predict the future. Scientists have been trying to predict, based on what we're seeing now, what we can expect the next few weeks and months to look like. Okay. My nose is running because my allergies. Hold on one second. I'm so sorry.
I love doing this because we're doing life with people.
Yeah, I
So,
mean, I'm a real person.
literally doing
I'm over
life.
here like, doing all of this. I'm sorry about that. But so scientists have put together these models based on certain variables to basically try to predict what we can expect. What they have predicted, and this is why we've kind of clamped down in the last few days, what scientists have been predicting is that the height of the cases and the illnesses about coronavirus that we expect to see is going to happen around April 16th. Now, again, that's a prediction, it's a model. It's not definitive, but it's what we are planning for, and sort of hoping it's better than that. But we're planning for that. So the idea is that after the 16th, the hope would be that it starts coming down. I mean, look, I hope we don't have a big curve like that at all. But
Yeah,
this
yeah,
is what
yeah,
we're
yeah.
thinking. The short of it is, I think this is going to, I think this is going to be here, and it's going to be affecting our lives in a major way, at least for the next couple of months. That's just sort of really an off the cuff guess. My hope is certainly that by late summer and things like that, we're going back to the beaches and going back to school in the fall. But the truth of the matter is, no one can predict exactly what's going to happen. This
Mm.
is why following the rules is really important. I know there's a lot of people who don't think that this really applies to them. The truth of the matter, it does. It
It
applies to
really,
everyone.
really does. I
Yeah.
I have two homes, one in Atlanta and then one in Florida. I
Mhm.
travel for a living, so I'm just about all over the world.
Sure.
And so coming back home just a couple of weeks ago, I found it necessary, instead of going home to my family, to stay in Atlanta
That's right.
and self quarantine.
That's right. I'm glad
And
you did.
I felt like that was the responsible thing to do. They,
Yes, it
you know,
is.
it was the last flight out of a particular foreign country. We were
Wow.
packed in. We left
Wow.
50 to 100 people at the airport trying to get out. But
Wow.
to be able to self quarantine was the responsible thing for me to do.
Yeah.
But you raised a lot of questions and or issues. And an interesting point that you raised was this inflection point, and we're going to reach an inflection point at some point. But since this is a global pandemic, communicable, it's affecting communities.
Right.
But as a global pandemic, it also has highlighted some of the strengths and the weaknesses of our healthcare system all over the world.
Absolutely.
So
Absolutely.
for me, as I think objectively and critically, this makes it an opportune time
Mm.
to investigate where the future of healthcare might be headed. Where do you foresee medicine going? And I know this is a
Mm.
heavy question,
Yeah, yeah.
but it's a lead-in question to 5G as well.
Sure, sure. So I think that coronavirus has changed the game for so many of us. Like, let me just give you an example. Because I'm not able and shouldn't be in the office, and we are not bringing patients in the office for routine visits for their diabetes and high blood pressure, and we shouldn't be, right? Myself and my colleagues, I'm an associate professor in the Department of Family Medicine at Rowan University in here in New Jersey. As a department and our entire university, we're seeing people through telehealth. And that's what most doctors are doing throughout the country. And one thing I'll say about that is I had never done telehealth before. And before I
Mhm.
was like, I don't know about no telehealth. I don't know how you can treat no patient through no phone, right? And the truth of the matter is, having done it and experiencing it, and I've talked to a lot of my colleagues who feel the same way, I think this has really opened up a whole nother opportunity and a whole nother way to see patients in a more mainstream way. Like, telehealth wasn't mainstream. Now it is. Every doctor is pretty much doing telehealth.
Absolutely.
Yeah.
We
So
are we are moving the needle where technology is concerned. I have a fascination with technology. I'm a very techie person, and I did a State of our Union address a couple of months ago in December, helping people to understand where the world is going. We are going to be a world controlled by AI. No ifs, no buts, no maybes. We are going to be a telecommunication. Um, World, we are going to see jobs being becoming obsolete. We are going to
mm,
do that. So
mm,
this is no ifs, no might, no maybes, and with that, people are afraid. So there's a lot of controversy
yeah,
surrounding the coronavirus as it relates to 5G. And I want to raise that and just talk
sure,
about that just a little bit to put people's nerves at ease.
sure, sure.
And those of you that are watching, I really want you to listen out because 5G has not caused the virus. It's impossible.
Yeah, it's not. And you use the word controversy. I would take it one step further and call it conspiracy. These are
Mm.
conspiracy theories, basically. And I don't say that with any negativity, but yes, there's a lot of people saying that 5G has caused coronavirus, but other things like, oh, coronavirus is a man-made virus, or it's a biochemical weapon that the government has made to fight people, things like that. I did a video about 5G and coronavirus, as well as the theory of it being man-made, a couple days ago on my Facebook page. Coronavirus is not caused by the 5G network. It's not a man-made virus either. And these are things that, it's interesting. Since I posted on Facebook and YouTube, I've gotten more, I guess, hate mail than I've ever gotten. What it taught me was how many people believe this concept. I knew people were asking me about it, and that's how I based my videos as on what people ask me about. Then I research the topic and I talk about it. So people were asking me about it, but I mean, honestly, on my YouTube page, it's got a lot of views in the last couple of days. Most comments are negative towards me. They're saying you're wrong, you don't know what you're talking about. Da, da, da. And what that told me was how many people actually believe that this is correct, that 5G has caused coronavirus. It
But
has
if it
not.
was true, and if there were symptoms, number one, your hair would be falling out and you would waste away.
Wait,
And
symptoms.
that
Wait,
is
wait, 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 back up, back up. Specifically, what are you talking about? If there were symptoms of
5G,
what? Of what?
5G, they're saying, oh, it's like a microwave
Well,
and
I
it's,
can't
you
talk
know,
about 5G because I'm not.
a-
I don't know what it
all
would
of
cause.
yeah, but all of that is just, people trying to figure out what exactly is
Sure,
going on, and
sure.
people are using their own imagination, and they're, turning to the internet to try to find out
Right,
what's going on.
right. And
Um,
I think
but
oftentimes,
I wanna help to eliminate the fear
yeah.
in people's mind and get you to weigh in.
Well, as I said before, 5G does not cause coronavirus. It's also not man-made. There are a lot of myths going around about it. I agree with you that in the absence of information, sometimes we, excuse me, sometimes we create our own information. And
Mm,
it's more of a conspiracy theory. I mean, these are things that I'm used to dealing with, though, because as a family doctor, I have a lot of people who tell me that vaccines will give people autism or that the flu shot will give you the flu. The way I think about the 5G coronavirus sort of conspiracy theory is very similar to those. They're false. Those are not true. This is the thing. And so people say, well, how is it spread, Dr. Jen? Well, we think that a coronavirus is a virus that typically, this coronavirus, remember, coronavirus is a family of viruses. There's more than one coronavirus. SARS was a coronavirus. MERS was a coronavirus. So it's like a family. And like my last name is Caudle. There are lots of Caudles. We're all different people in the same family. That's what
mhm.
coronavirus is. COVID-19 is the specific coronavirus that we're talking about. That's a virus we had not seen in humans before. We think it jumped from animals or animal hosts and jumped into the human population. And you say, well, why don't we know then? Why da 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 da? Well, we don't know because we keep calling it the novel coronavirus. Novel means new. The reason why we don't have answers to everything and we can't always answer people's questions is because it's new. And I think sometimes in the absence of the information, people say, oh, it's a conspiracy. Oh, it's man made. It's a government. Why don't we know? There's really good reasons why we don't know. I mean, that's how anything comes about. There's
Yes.
everything is new at some point. This virus is new right now. So, and the other thing I would say about that is believing and putting faith into conspiracy theories like this or falsities. What that does, the problem with it is it takes away from us putting stock into what is real and what works. The more time we spend worrying about 5G and coronavirus, maybe the less time we spend social distancing, washing our hands, staying home and doing all the things we know actually works. There are other conspiracies too. I heard that Black people don't get coronavirus. I did a video on this. And I was quoted, extensively about it. I did a video on like all the myths I've heard. They say that Black people don't get coronavirus, I guess, because in the beginning we weren't seeing it in Africa a lot. Well, clearly we know that's not true. Viruses don't discriminate. They'll infect anybody they like, and we know Black people can get it. So, yeah, that's one of the reasons why I'm doing my daily videos on my Facebook page, Dr. Jen Caudle. I'm trying to dispel these myths and trying to explain why they're not real, but also to encourage people. I don't ever criticize or I don't blame people for believing the things they hear because in the world we live in, there's so much information out there. If I
Yeah.
weren't a
Yeah.
doctor, I would have a hard time sifting through what's true and what's not myself. It's one of the reasons why I do these videos is because there's just information coming from everywhere and it's hard to know what you can believe.
Exactly. Okay. So COVID-19, and is it a biopathogen? And explain what that means.
I don't know what that means. I don't know what you mean by that. What do you
Okay.
mean? What do you mean?
This is one of these are the words that are floating around
Yeah,
in
I don't actually know what that means. If people are asking if it's
cyberspace. Yeah, it's just floating around. These are things people are sending me
saying,
email. You know, this
my
is a
guess is that
biopathogen, and is this bio warfare?
okay, so what I think the connotation is this man-made and the
Hmm.
government warfare, bio
Hmm.
warfare. I think that's I don't know what biopathogen means as a phrase, but if someone is asking, is this virus man-made and an attempt to attack people, governments attacking people, whatever. I've gotten those questions too. The answer is no.
Hmm. Yeah. Good, good, good. I know that your time is precious. You're going to be seeing patients on this amazing platform that we call technology.
I know, right?
Yes. So I want to thank you so much. There's so much
Of
that I
course.
wanted to talk to you about. I want to respect your time. How can people get in touch with you?
Great. Thank you for asking. And is it okay if I just give one little message of hope? Because I want to leave on a
Yes.
is that
I
okay?
wanted that was my
Okay.
second. That's my
Okay,
second
good.
one.
Okay,
Yeah,
great.
I wanted you to be the final voice, but I wanted them to hear, give them an opportunity to grab a pen or their phone and write down the
Sure.
information we're about to give them.
Okay, good. So as long as we get to that, that's fine. So my information is I would love people to check me out on social. That's Instagram, Facebook, and Twitter at Dr. Jen Caudle. That's DrJenCaudle. I'm doing daily videos on coronavirus, trying to answer your questions. So people send me questions every day. I have a free health newsletter that you can sign up for on my website. That's at drjencaudle.com. It comes out with weekly free information about your health and lately about coronavirus. So just trying to do my part to give us information that will help us be safe and healthy. Yeah, I just wanted to say, because we've been talking a lot, and my viewers and my followers, I'm sure yours are too. They're very vocal, and I appreciate that. But they tell me how they feel, and I was getting a number of emails or posts saying, "Dr. Jan, we appreciate you telling us what doesn't work, but what does work? Can you give us some good news? Can you tell us something good? You tell us what's not working, what's wrong, and what's this." So, and I always try to keep that in mind because it's a good point. So, what I want to say is, in the last minute or so, is we will get through this. I know this is scary. I know this is overwhelming. It seems almost like we're drowning in a way, but
Yeah.
we're gonna get through it. We're going to get to the other side, and I want us to all remember that. I also want us all to remember that 80% of people roughly have mild to moderate disease and do okay. Meaning they don't necessarily need to be hospitalized and things like that. Now, I did a video on that too, and unfortunately, churches throughout the world and other organizations were using that to tell people they could go to church and be out. No, that's not what I'm saying. I'm not saying that. I'm not saying you can go and hang out with your buddies because 80% of people do fine. But I'm saying that to let us know, first of all, not everyone doesn't die from coronavirus. That's a question people ask me.
Mhm.
80% of people will recover and do well, and maybe even more than that. My point being is, and the last thing is, we can change the course of this illness. You have a role in affecting the likelihood of you or people you love getting infected with this by our behaviors. So what we should focus
Mhm.
on are the things we can do. We can do things to affect this positively. Staying away from others, staying home, wearing a mask now. That's the new regulation by the CDC. I agree with it. Wear a cloth mask, a bandana, something around your nose and your mouth if you have to go out. Cough or sneeze into your elbow. Wash your hands. Use hand sanitizer. Disinfect surfaces at home. Don't touch your face. Focus on what we can do. So,
Yes, that's fabulous. Well, thank you so much. Thank you for your time. I
thank
look
you.
forward to talking to you again sometime soon. And
Thank
those of you
you.
that are viewing, it's just been a wonderful time to do life with you. Stay safe, stay happy, stay healthy. God bless you. God bless America, and God bless our world. Until we meet again, we'll talk to you real soon. Bye bye for now.